Notice they're very small packages because we're watching our diet. And of course the logistics team that just do such a brilliant job with PMA as well as our Te Maraeora staff. And then of course we came to our choir, our children, our future. This was such a beautiful time, and many of us reflected on this throughout the day, and even at our women's breakfast this morning with Liz Ilo speaking for our women's breakfast. Then of course, we had Bishop Tudai Pere, who spoke about the laying of the foundation for this conference, reminding us all that Jesus was about healing, reaching people, being a physician and savior to all, and that he died and rose again. And even today's sermon, though brief, very touching, very moving and deep. Thank you very much, Bishop Tudai Pere. Then we heard from Lord Viliami. Thank you very much, sir, who impressed on us PMA's achievements over many years, the vision, our aspirations for the future, and noting that we've set the target now with 600 at this conference and an expectation that 2,000 will come for the next conference. And he reiterated the importance of working in partnership with our communities. Then our president, Dr. Kiki Mawate, highlighted the reason for our conference, and the theme really came through strongly around our vision for our Pacific children living longer than anyone else on this earth. And I think that was also aligned very well with our young children, our future, who came to sing with us yesterday. He also highlighted the importance. He spoke a lot of Maori, Cook Islands Maori. I've never heard him speak that much in one go, and I was so proud of him. And he's probably still in bed because I haven't seen him this morning. He highlighted the importance of language in keeping us grounded in our heritage and connected to our families and the communities we serve. And so that was really very moving and shifting in terms of setting the scene for our conference. Then we moved on to our dear PMA CEO, Debbie Sorensen, just one powerful woman who spoke of the privilege she has experienced and as a family about being able to support all the work that's been done by PMA, and being grateful and gracious about those that have come to help and those who will partner with us now, in the past, and into the future. She also highlighted the fact that with PMA, as an NGO, it is quite agile and able to mobilize and help serve others, especially in need. She also reiterated the conference theme, to enable health professionals, enhancing the knowledge of our health professionals, sharing experiences and best practice, and making new friends and connections. Then we moved to our Minister of Health, the Honourable Vainetuta Ibros Toki Brown, and I hope many of you have had time to talk to her. She's very passionate about moving the health outcomes and lifting the health outcomes, especially of the Cook Islands population, but in general Pacific as well. And she talked about the need for us to have a look at the NCD challenge. She talked about the new dawn post-COVID and the need for us to just keep lifting and moving forward. And then this beautiful picture. I thought I'd pinch it off Facebook from last night. Just beautiful, just showing the big family that we had yesterday at our opening conference. Then of course we broke for morning tea and we were reconnecting with everyone outside, and it was just lovely to see so many people, lots of hugs, lots of kisses, and lots of big smiles yesterday, and I'm sure our team have taken many pictures for that. Then we went to our panel, Health Across the Oceans, some very powerful messages coming through. Remote communities, rural communities, how do we ensure we reach them? Data, or the lack of data, and the need for us to figure out how we can access good data, undertake surveys, and there's actually a lot of existing systems in place that collect data, but much of it is hidden, and just finding out how we can access those systems. Then of course, Bob referred to building our own human resources. There was quite a lot of information around building our nursing capacity, looking at the retention or migration of our nurses overseas to other places. But I think what stood out for me was around leadership. This was Dr. Paula referring to the importance of leadership in health systems, because I think that's really quite apparent and grounding for many countries where good leadership leads to a better skill set in terms of workforce, health systems, and IT and so forth. And we moved into the being brave, and John spoke to us yesterday, and it was so lovely listening to another view from a very far place, far away in an icy, cold place. And it was just lovely to hear, especially reminding us about the indigenous models of care that we can draw from to help us become more resilient to climate change and the impact that it is creating for us. Then Debbie Sorensen spoke to us again about the humanitarian response with PACMAT, the Pacific Medical Assistance Team, the partnerships that are existing within PACMAT, as well as some of the big work that's been done by PACMAT. I've put it here purposely because I think this slide was, is so important to highlight these. Otherwise we forget some of the work that's been done in the past and the manpower that had to go into that. And when you dig deeper into these efforts that were made, you'll see a whole variety and diverse health professional capability that PACMAT was able to draw in at various stages depending on the need. And I think that was the message that came through about our need to have a flexible set of skills, so we surge in a particular area that needs particular skill sets, including language. And the big one for us is mental health. That's been important in terms of psychologists and assisting those that are reacting to acute stress environments. Then we had our panel of 4. Carlo giving out chocolates, so I think, was it our dental people were away at the time, so they didn't see the chocolates. But it was just lovely hearing all 4 speakers, and Marianne as well, speaking on PACMAT and some of the work that's been done. And I must say, just so proud of, I'm so proud of the team that's been put together and some of the responses that have been conducted, especially in recent years. Then of course Basil, who spoke from a Vanuatu perspective around HR as well, and then Dixon from the WHO team and some of the experiences he's faced as well. And so that was the end of day 1, Ra'ta'i. So today is Ra'rua. And we had concurrent sessions. I couldn't get to all of them, but it was quite good just listening to some of the conversations coming from some of the presenters and just the learnings. Then we did the RAROTONGA hospital visit. Thank you very much to Dr. Deacon Tiapa and the hospital staff for facilitating that. I thought it was brilliant. And we had John Dunn, Dr. John Dunn follow us, and we were watching him. Now, why is he looking at the surgical ward? That's his ward. Just walk inside. So, only because he's done so many laparoscopies and endoscopies in this country. So it was like nice to see a lot of people and new friends. And we also had quite good discussions with Douglas To'u, the head of our laboratory services, talking about our PCR capability. Thank you, SPC, Dr. Paula Vidili, for facilitating that during 2020 when we had COVID. And of course, our CT scan, which was facilitated with Waitemata District Health Board. Then we had the beautiful tamarind cocktail event last night. really, really good. And maybe tomorrow's reflections will tell us what happened last night. But apart from that, just hoping everyone enjoys their time today. Thank you so much for your generosity in spirit, generosity in exchange of information, and also just being you today. Kia ora na, kia manuia.
Thank you, Dr. Herman. Yes, beautiful photos. Those that wasn't here yesterday to catch you with the photo, there is a Photoshop we can cut and paste your photo and put it in there somewhere. But again, I'd like to welcome to all our dignitaries. Kia ora na tātou katoa.